The nursing student cares for a patient newly diagnosed with inflammatory bowel disease, IBD. He decides to review the different types of IBD, ulcerative colitis and Crohn's disease. Which of the following statements is not true about these types of IBD? A. Ulcerative colitis usually manifests with fatty stool, steatorrhea. B. Complications of Crohn's disease include fistula formation and intestinal obstruction. C. Ulcerative colitis and Crohn's disease may occur in very young children. D. Complications of ulcerative colitis include hemorrhage, abscess formation, and arthritis. E. Crohn's disease presents with weight loss, anemia, and dehydration. The answer is C. Ulcerative colitis and Crohn's disease may occur in very young children. Ulcerative colitis has a usual age of onset from 20 to 30 and 50 to 80 years old. Patients with UC have frequent fatty stools with occasional rectal bleeding and abdominal pain after eating. Nurses who care for patients with UC must consider possible intestinal obstruction and fistula formation in these patients. Crohn's disease has a usual age of onset from young adults to middle-aged, 30 to 50 years old. Patients with Crohn's disease did not have fatty stools but do have common rectal bleeding that may lead to hemorrhage. These patients experience pain before defecating and will have 10 to 20 liquid, usually bloody, stools per day. Nurses who care for patients with Crohn's disease should consider possible abscess formation and arthritis. Both UC and Crohn's disease present with weight loss, anemia, and dehydration due to ineffective nutritional absorption through the intestinal tract. Nurse is discussing with a 56-year-old male client causative factors that have led to his development of peptic ulcer disease. The nurse realizes that there is need for further teaching when the patient makes which of the incorrect statements? A. I will eat several small bland meals daily, and avoid irritating foods such as raw fruits and vegetables. B. I will take my prescribed triple therapy with antibiotics and proton pump inhibitor to eliminate the H. pylori infection for 2 months as instructed by my physician. C. I will quit smoking, as I understand nicotine contributes to the development of gastric ulcers. D. I am aware that I should engage in relaxation techniques to minimize stress, to help reduce the acid my stomach produces. E. I will avoid certain medications such as aspirin, NSAIDs, and corticosteroids. They are capable of disrupting the stomach lining. The answer is B. I will take my prescribed triple therapy with antibiotics and proton pump inhibitor to eliminate the H. pylori infection for 2 months as instructed by my physician. The treatment for peptic ulcer disease when the bacterium H. pylori is found to be present has several treatment strategies. These strategies include a triple drug therapy consisting of a proton pump inhibitor, amoxicillin and clarithromycin. This combination of drugs should be continued for 7 to 14 days, 2 months is not the course of treatment. All other statements are consistent with proper teaching of causative factors associated with peptic ulcer disease. A nurse is retrieving a report from a hepatic biopsy in a patient with an acute hepatitis B infection. The report describes swollen hepatocytes with irregularly clumped cytoplasmic organelles and large clear spaces. This is known as which of the following? A. Ascites. B. Ballooning degeneration. C. Fibrotic changes. D. Necrosis. The answer is B. Ballooning degeneration. Ballooning degeneration is a form of hepatocellular apoptosis, rather than necrosis, in which hepatocytes swell and begin to show irregularly clumped cytoplasmic organelles and large clear spaces. It is a severe condition often seen with viral hepatitis or steatohepatitis. It is distinct from fibrotic changes, in which depositions of collagen fibers are seen on histology. Ascites is a collection of fluid in the peritoneal cavity, rather than a histological feature. Which of the following is not a response normally seen in liver disease? A. Necrosis. B. Inflammation. C. Intracellular accumulation. D. All of these are commonly seen in liver disease. The answer is D. All of these are commonly seen in liver disease. The liver generally responds to injury in the following ways: inflammation, necrosis or apoptosis, degeneration leading to accumulation of intracellular deposits, fibrosis, and regeneration. Some of these, such as inflammation and mild degeneration, are reversible. Other changes, such as severe degeneration and fibrosis, may be permanent. You are assessing a patient complaining of 3 days of fever, crampy abdominal pain and profuse, watery, mucoid, non-bloody diarrhea. The patient recently completed a course of clindamycin after having her wisdom teeth removed. The patient has not eaten any raw foods, red meats, shellfish, seafood, or greasy foods recently, and has not had any recent travel. What is the most likely cause of her diarrhea? A. Clostridium difficile. B. Cryptosporidium parvum. C. Escherichia coli. D. Shigella dysenteriae. E. Salmonella typhi. The answer is A. Clostridium difficile. The most likely cause of this patient's diarrhea is Clostridium difficile, also known as C. diff. Clostridium difficile typically causes watery, non-bloody, mucoid diarrhea, associated with fever and abdominal pain, most commonly in patients who have completed a recent course of antibiotics. In the past, it was thought that clindamycin was the most frequent antibiotic-related cause of C. difficile, but recent studies have shown that other classes of antibiotics, including cephalosporins, are associated with comparable rates of C. difficile diarrhea. In this patient, the characteristics of her diarrhea, associated symptoms, and recent antibiotic exposure are most consistent with C. difficile as the cause of her diarrhea. Escherichia coli exists in multiple subtypes, but often is associated with bloody diarrhea after eating undercooked red meats, ecdiarrhea, or watery diarrhea after traveling to a foreign, undeveloped country, ETEC diarrhea. This patient's history is not consistent with E. coli infection. Salmonella and Shigella diarrhea are each typically bloody. This patient's diarrhea is non-bloody. Cryptosporidium parvum diarrhea is often watery, as is the case in this patient, but it frequently occurs in immunosuppressed patients, is typically not mucoid, and does not have a known temporal association with taking antibiotics, as does C. difficile.